So this horse had sustained osseous injury as a result of the previous kick injury on the plantar aspect of the hock. This horse also has a huge swelling on the plantar aspect of the hock and had a draining sinus following a penetrating injury approximately 3.5 months previously. The swelling was firm on palpation and no exudate could be found. However, ultrasonographic evaluation revealed that there was abscess formation with no involvement of the calcaneal bursa or the superficial digital flexor tendon or the underlying osseous structures. So this was surgically removed and the horse made a complete functional recovery. Now to consider curb-like swellings, swellings on the plantar aspect of the proximal metatarsal region. And these can be the result of one of a number of things. There may be abnormal prominence of the base or the head of the fourth metatarsal bone. This is just a congenital anatomical variant. This curb-like appearance may be secondary to collapse of the central and/or third tarsal bones as a result of incomplete ossification at the time of birth and subsequent collapse of the bones. It could be the result of subcutaneous peritendinous fluid or fibrosis, fasciitis associated with the soft tissues on the plantar aspect of the superficial digital flexor tendon. In more severe cases, there is not only peritendinous reaction, but also superficial digital flexor tendonitis. And in some horses, in addition, we have desmitis of the long plantar ligament. So to differentiate between these various causes, it requires careful palpation, radiographic examination in selected cases, and ultrasonography. So this image on the left is of a 2-year-old thoroughbred in training, which was lame, had a curb-like swelling. The lameness was bilateral. The conformation of both hind limbs was very similar. And this was a young horse that had collapse of the central and third tarsal bones and very severe osteoarthritis. The changes were worst involving the third tarsal bone and its articulation with the third metatarsal bone. This is a Connemara event pony with bilateral swelling on the plantar aspect of the proximal metatarsal region and bilateral lameness. The swelling was firm and non-painful on palpation. However, ultrasonographic examination revealed fairly extensive peritendinous reaction with echogenic material on the plantar and plantaromedial aspects of the superficial digital flexor tendon. The superficial digital flexor tendon itself was somewhat heterogeneous in echogenicity and slightly enlarged, and the plantar aspect of the plantar ligament was also hypoechoic. To further consider soft tissues on the plantar aspect of the hock, we need to consider the tarsal sheath, which encloses the lateral digital flexor tendon. This tendon has a retinacular attachment plantaromedially. Be aware that ultrasonographically, on the dorsolateral aspect of the tendon, it often appears relatively hypoechoic, reflecting its different architecture, being more cartilaginous in nature. In the horse on the right, we can see extensive distension of the tarsal sheath, extending from proximal to distal to the hock.